I'm Dr. Frank Noyes, and this is the Arthrofibrosis Center, and we're speaking to you from Cincinnati, Ohio, and I'd like to introduce Paula.
Yes.
And Paula, you've had a problem with your knee, and you have diagnosis of arthrofibrosis, and you're from Fort Lauderdale, and you had the surgery about 10 months ago.
Yes.
Your first total knee.
Yes.
And you were telling me, what was it like after your surgery? You did get into a problem with scar tissue. Can you describe that for us?
Well, it was very painful, and I lacked range of motion, and I was stuck at bending at 70 degrees, which was very debilitating
Yeah,
and painful.
And you probably had multiple different explanations for it or opinions?
Absolutely. A lot of confusing and contradicting opinions.
And we were saying before, people don't realize how devastating arthrofibrosis is.
It's very debilitating. At 70 degrees, I couldn't go up steps or get into a car or sit correctly, so it was debilitating.
Right, and so when we saw you, we had a long talk, didn't we?
We
Talk.
We sure did.
Okay. But so far it's worked out, and you've had surgery,
Yes.
and so we get to brag a little bit about you. Can we do that? She's been an excellent patient. And
I followed the rules.
that's right.
Yes.
You did follow. And how is it to be in Cincinnati for 4 weeks?
Well, Cincinnati's lovely. Everybody is very helpful here, and of course, I found, the answer to my prayer. So it's been absolutely wonderful. I mean, heaven sent, really.
Oh, you're so nice to say
So
that.
I mean it.
Okay. And so her kneecap is now moving.
Oh yeah, it was stuck before.
Before it's stuck. And so we're now only 4 weeks out.
Yes.
And you want to show off a little bit, and we did
Oh.
get past 70.
Yes.
And keep going.
Yeah.
And keep going and keep going. And what did we get today? We were 115?
Yeah. Well, I've been measuring at 117.
Oh,
from
that's
70.
great. And so before you were at about 70. And so we are, and I don't want to push you because
No, I'm good.
we still have work to do. And after surgery, we did actually get you back to 140 degrees,
Oh, yeah.
all the way back. And so you're leaving, going back to Fort Lauderdale, but you're on a whole program.
I am.
And part of the program, besides surgery and rehabilitation, the third part is using medications to attempt to keep the scar tissue coming back.
Yes.
And so you saw a rheumatologist that works with our center.
Yes.
And how did that go with Dr. Fritz?
Dr. Fritz is a very knowledgeable rheumatologist. No nonsense, serious, but absolutely knowledgeable. And the combination of physical therapy, surgery, and the rheumatology,
And
the
medication.
medications have really worked.
Yeah, and importantly for me, it's kept down the post-operative swelling.
Oh,
As
yeah.
I look at your knee, can we just peek underneath this
Oh
for
yeah,
a minute?
absolutely.
So we are very fortunate. If we look at this and all the surgery, she really has minimal swelling. And your scar tissue was like we see so frequently. We used this smaller incision. Your scar tissue was all bound down here, all bound down here, all the way to the top. And then we had to lengthen these tissues to get that kneecap working again. So you were very good, and we're very pleased.
You were very good.
Okay. And let's bring in Chad. Chad's worked very hard with
Yes.
you.
Yes.
And so you and Chad have formed a very close bond, like we have to. And Chad, we're going to ask Chad, what do you think, Chad, were the more difficult parts as you worked with her? You did a wonderful job working with her. What do you think were the more difficult issues?
Yeah, I think the most challenging part is the educational component of it. They've had therapy done in a completely different manner for so long, and I think teaching that component of how to address range of motion in the proper way is probably the most challenging thing.
And the best way is gentle.
Gentle, absolutely.
And you experienced some pain with therapy. Push it harder, push it harder.
Right. In my previous experience, I was asked to push beyond the pain, and then I would just get
worse.
I would get worse, and then the range of motion would actually decrease. Instead, here you get a more gentle approach, and and
We don't want you pushing into pain.
exactly, and I've
So-
gotten better results.
And we talk about it like a rubber band. You're just gradually stretching it out. And if you can keep stretching it out gently, then you can continue one day after another. Or if you did it all of a sudden, it would be painful and you would lose it. So
Yeah, no, and with the guidance of Chad and Dr. Noyes and the whole team, it's been a wonderful experience, really
Okay.
life-changing.
well, thank you.
Yes,
And
I'm thrilled.
You get a lot of credit because it's hard for a patient. And just as a final note, we used to do this with the patient coming and going, and we just found out we can't do the whole program.
Exactly.
And so you have to commit to be here with us for 4 weeks
Yes, it's
to
key.
do it.
It's key because when you go home, you lose a lot. Life gets in the way, things at home. All of a sudden, it's the middle of the day and you haven't done your exercises because
Got it.
life just happens. But here, you get to focus and you have the team, the support, and here are the results.
Yeah. Thank you.
Thank
We're going
you.
to do this. Okay.
Thank
Now,
you.
so this is Dana. And Dana, you're from Virginia.
That's correct.
And so you had your total knee how many months ago? First one
The first one was in July of last year, and this one was October of last year.
in October, right?
So about 10 months.
Yeah, and what did you experience after that led you to have to come here?
Well, I had had 4 knee surgeries in the past, and knew that I had developed scar tissue. That's something that I knew. It wasn't as severe, but this time with the total knee replacement, at about week 5 or 6, I was just plateauing and even regressing from what I had done
Okay.
the first few weeks. And I kept telling the therapist, something's wrong. You know, I know I'm having scar tissue, and I can't. It's just getting worse. And they said, just keep doing what you're doing. Just keep doing what you're doing.
Right.
And so I literally did exercises every day for a year, and it didn't get any better.
So you
It just
really
got
worked
worse.
hard.
Yeah, because I'm also an occupational therapist. and
You're an
I-
OT, so
I
you
know
know
how
about-
important it is to do those
Yeah,
things. Yes.
yeah, so you were
I've
really
seen it on
committed.
both sides, yes.
Yeah.
But it's just
So
gotten worse.
okay.
And
So-
just like, Paula, the quality of life and getting in and out of the car, I have to use an elevated toilet seat, shower chairs, your whole life is completely different than
Well, you're a younger person,
right,
and
it
you
still
knew
needed all that.
that you weren't going to have to live with this for the rest of your life.
Well, I was sure hoping, but
Yes.
no, I went to
So-
several different PT places too, tried just to see, and it just
Right.
didn't matter because they all kind of said the same thing over and over.
Okay.
So we were very
I
fortunate to
don't know.
find you.
I don't know how you got led up to us, but that's good that you've been here.
Yes.
But we get to brag on you because when did you have that surgery done?
I had this surgery done on Monday, so 3 days ago.
Isn't that amazing? So she's 3 days out, and again, using modern medication. Can we take a look at that?
Sure.
How are you doing?
I'm doing well overall, especially
Okay.
for 3 days.
Yes, you are.
I haven't taken any medication, any narcotics.
So you did have local blocks that we used at the time of surgery. And so this is the way we like you to look after major surgery. And so you had the same thing like Paula. It's almost exactly the same. You had all this scar tissue here that we released. We used a smaller incision here. We didn't have any incision up into your muscle. And so we released this, we released it up here, we released it on the sides, and then underneath we released it. And so your kneecap is now moving again. I don't want to hurt this because you're only 3 days, my goodness. And so, and we did on you were stuck at about 70.
A little bit more
80?
than that, but yeah, this one was a little bit better with flexion. This one was a little bit better
Yeah,
with
and I
extension.
might say, unfortunately, the same thing has happened here.
Right.
And so this is going to be part 2, isn't
Right.
it?
Yes, it is.
But now you want to kind of show off your knee, and so we already have more than you had before. What do you think of that?
Not bad for 3 days.
Oh, that's wonderful. Isn't that something? Yeah, so we've already got the motion. And so now that's all the good news.
Right.
But now we have to be realistic because after surgery, in the next week or so, that's going to start to swell up. And we're going to prevent that. And we're going to use medications and other things because we have to keep what we call a dry knee, and we have to keep that mobility. And if you lose any motion at all, we'll go right back and do a very gentle ranging of motion. I don't like to use the word manipulation,
Right.
but we just will very gently move your knee while you have twilight sleep for just 5 minutes, because we're not going to lose that motion.
Right.
And so you're up here with us for a while?
Quite a while. We're not sure how long it'll be with both of them, but
Yeah, well, but certainly 4 weeks.
oh yeah, more than that.
And yeah, and you're in Cincinnati. You like Cincinnati?
Yeah, and everyone, I agree with Paula. Like the medical care is like nothing I've ever seen.
Oh,
Honestly,
that's
in
nice.
this- in
That's
this
nice of
building.
you to say
I
that.
mean, it's
Yeah.
state of the art, but also the therapists are so incredibly kind
Right.
and supportive. And if you need help, everyone offers help.
Good.
It's really nice.
You need that support,
Yeah.
because arthrofibrosis is just a debilitating. It's really a disease.
It is absolutely debilitating.
It is.
People
And
don't realize that, I don't think, or someone will say, I had a little scar tissue, but it's like, it depends how much you have, but if you have enough to cause this many problems, it's,
and we were talking before, it's more frequent than you really think. It's actually very prevalent. And so the program that we established that you're going through, we've actually been doing this for over 20 years.
I know, and you're one of
Yeah.
the only ones in the country that really worked on it.
Well, I don't want to claim that, but I think part of the problem with arthrofibrosis is we need good clinical research, because we still don't have all of the answers, and we're working through a program. There's other centers that are working through their programs. We respect all of them, but we're very pleased so far
Well, I'm very pleased
with the
too so
results of
far.
our program. Okay, well, thank you
Thank you. I
for
appreciate
talking
it.
to us.
My pleasure.
Okay, very good. Thank you all.